Hello, everybody. Welcome to another episode of You're the Cure. I'm Dr. Ben Edwards. We're going to talk measles today. I know the world or the corporate media is giving one side of the story. I've been talking about it to various news outlets, but really trying to just stay focused on my patients too and want to kind of move on to the next subject. However, it's so important, I think, to get this podcast out and to have it for posterity's sake, because the truth needs to be well known so that we don't repeat the mistakes of the past, some of which we have actually during the measles outbreak already have forgotten things from COVID. But we're going to talk about that today. We're going to talk about the science of budesonide. We're going to talk about treatment versus prevention, how those should be two different subjects. And how is it that some doctors seem to have forgotten how to treat while other doctors know how to? So I'm asking one of those physicians who's a great physician and a great man, colleague and friend, Dr. Richard Bartlett, who had some divine inspiration during COVID, and we'll hear that today, on how to treat COVID and how that translated into the current measles outbreak and why I decided the first night I went to Gaines County to utilize budesonide. So I've asked Dr. Bartlett to come on to share his story, share his wisdom, his knowledge, and just share a part of his life with us. So Dr. Richard Bartlett, thank you so much for joining us today.
Dr. Ben Edwards, you're a leader in healthcare, and I'm honored to join you.
Well, thank you. I've felt like I got called that Saturday night to Gaines County, and I would have done what you would have done for sure. And I would think any doctor would do that had compassion and had just common sense, even I would say, go and just treat the symptoms that you saw. And the reason I picked up the phone and called you is because there were some patients in the hospital that needed some help, and I felt like budesonide would help them quite a bit because I was seeing dramatic results with it, just as we did during COVID. And I actually texted you and said, what's that website with all the evidence? Because doctors need evidence. And you sent it to me, and I forwarded it on to some parents in the hospital. And that wasn't quite enough. So then we'll get to that story. But I want to set it up first. I want you to share your background. How in the world did you get to be where you are now, and why you think like you think, and how did it come to be where I would think to call you, where you went to the hospital and face-to-face had a very polite and cordial discussion with the doctors who were great to receive the new knowledge that they didn't have before on budesonide. But tell the audience a little bit about your background and where you came from and how you got here.
Well, it's a long story. My father's a doctor. My mom is an RN. And so I grew up in a household that talked about medical issues around the dinner table. And my mother went in for an elective procedure in Lubbock at a hospital that I was a surgery resident at, and she was going to have an elective outpatient procedure, just a diagnostic procedure. And she actually had some nightmares before the procedure, felt like there was going to be a disaster. She met with the attendings in the gastroenterology department 3 times and asked what they were going to do, what they weren't going to do. And long story short, they did the diagnostic test, but they decided they would go a step farther and use a cautery and blindly cauterize and perforated her bowel. When the procedure was over, they told me and my father, who was a doctor, and I was a surgery resident in that facility, on duty that day, a senior resident. And they told us that everything went great, no problems, but she was in terrible pain. They put her in the hospital overnight. And I was the surgery resident on call that got the emergency call on my pager that we had a surgical emergency on the floor. It was my mother. I called in the surgery crew, and my attending called the surgery off without explanation. This was totally against what's in the textbooks. This was a textbook case of a perforated bowel that needed emergency surgery, and they delayed the surgery for 4 days without explanation. We found out later they were meeting with the hospital attorneys and the hospital administration, And it took a month for her to die on Mother's Day. That left a mark on me, and I knew that patient rights was not going to be optional in my mind, in my career. And so for the last 34 years practicing as a physician, I have been a patient advocate. I've been a patient rights advocate. And that was something that was understood in traditional medicine, that patients have fundamental patient rights of informed consent, being told what the treatment options are, what the risk and benefits of the treatment options are, and if there's a financial conflict of interest. We found out that there was a cap on what would be the loss to the hospital in a county hospital if a patient died from malpractice. But they would have lost 4 times as much taking care of my mother for her long-term health illnesses as a result of that complication. So they did the math, and that's why my mother was allowed to die, actually, instead of having aggressive treatment. And so I learned a lot. I went to a medically underserved county on purpose to practice. I wanted to meet the greatest need in West Texas, so I went to a medically underserved county, and was the only doctor many times in the county, taking care of everything in the ER, everything. I was the rural health officer. The county health officer. I was the rural home health supervising doctor. I had a busy practice. I was the medical director of private ambulance services, public ambulance services. Because of what I did, I became the medical expert for West Texas CBS News. For 23 years, I was on weekly covering medical issues. And Governor Rick Perry asked me to serve on a new task force he was forming called the Public Health and Medical It was called the Texas Health Disparities Task Force, the Texas Health Disparities Task Force. And so I was on that for a 2-year appointment by the governor himself. After 2 years, he said, "Would you stay another year?" And every year he asked me at the end of the year, "Would you stay another year?" for a total of 7 years. And we accomplished a lot to make sure there was increased access to quality healthcare for inner city, for rural, for all ethnicities, for all cultures in Texas. And so at the end of the 7 years, I was surprised to be presented with the Meritorious Service Award by the Texas Health and Human Services Commissioner. And so that's my background. When COVID happened, I was working as an emergency room doctor full-time in Lubbock, Texas, in West Texas. And in March of 2020, I remember showing up for a 48-hour shift in the ER and watching for the White House Coronavirus Task Force updates on TV like everybody else. I remember that we were all told the strategy was to shelter in place, hide in place, and that if you were sick, the message from the state of Texas Health, from the federal healthcare system, with Anthony Fauci being the spokesman, was that if you're sick with COVID, stay home. Don't go to the emergency room. Don't bother the ER. Don't bother the hospital. Don't bother the doctors. Wait till you're really sick and then go. And we're ramping up ventilator production, and we got a ventilator for you. And so that was the early treatment strategy. And when I went to that 48-hour shift in the ER, that was what was going on. And I showed up to take care of heart attacks, car wrecks, strokes, sewing people up, fixing broken bones. And I'm a Christian as well. So I was praying in between patients, "Lord, what do I do if someone comes in here and they're dying of COVID? They're saying there's nothing we can do." And I was really distraught, Ben. So I was praying and praying. And then I had a moment where I had no patients in the ER. So I went to the call room to take a quick cat nap to survive the 48-hour shift. And while I was asleep, an answer to prayer came to me, and why to use it. The inhaled budesonide, an inhaled steroid by a nebulizer treatment, because it'll shut down the release of the cytokines, the inflammatory chemicals from the lung lining that cause the fever, the chills, the shortness of breath, the body aches, the vomiting, the diarrhea. We know what those cytokines are. And then also it also helps with oxygenation. It helps with decreasing inflammation in the lungs. It decreases mucus production. All those things were benefits. The second part was aspirin to decrease clotting. We saw with COVID that there was this propensity to have clots of every kind in people who were healthy before they got COVID. And I know because I did the research that thromboxane is one of the cytokines released during COVID from the lung lining. Thromboxane increases clotting. Budesonide shuts the release of that to zero. And so aspirin was a second part of the strategy to prevent the strokes, the clots in the lungs called pulmonary emboli, the DVTs, the clots in the legs, the clots in the coronary arteries causing heart attacks. And so aspirin was the second part of the strategy. The third part was clarithromycin, an antibiotic that covers walking pneumonia, the atypical bacteria, and also covers encapsulated bacteria like strep pneumonia. So it covered everything that was a culprit for a secondary bacterial infection. So it was a three-part strategy, very simple: nebulized budesonide, aspirin, and an antibiotic that was generic. All three of these things were generic, inexpensive, readily available around the world. And so we saw that it started saving lives of people that were very critically ill. They had many risk factors. A lady that had triple bypass surgery, had heart disease, had a heart attack, short of breath, chest pain, calls me on day 5 of COVID. With the first breathing treatment, her chest pain goes away. She recovers quickly at home. Had a lady who had 2 forms of lymphoma on chemotherapy, had radiation therapy a month before, deathly sick. With the first treatment, her chest pain goes away, her fever breaks, she recovers at home without having to go to the hospital. I saw extreme cases, stage 4 prostate cancer, having to be carried into the car to be brought in for his chemo for his stage 4 prostate cancer. He beat COVID at home, but he eventually succumbed a year later to the prostate cancer. And so we saw people who had serious pre-existing conditions that were recovering from COVID. I presented this strategy on podcasts. One went viral on America Can We Talk with Debbie Georgatos. That was in July 3rd of 2020, where I said, we don't have to be afraid of COVID anymore. We have a winning strategy. We've cracked the code. We have budesonide as the silver bullet of my strategy for COVID. I got such pushback. I had 4 attacks on my medical license with anonymous complaints from corporations that had vested interests in the COVID shot and were part of the establishment against my license to the medical board. All of those were dismissed as frivolous, bogus. They did not leave a mark, but it was still upsetting to me and my family to go through that. You can imagine. Mm-hmm. And then a year later, Oxford University, the oldest university in the English-speaking world since 1096, Oxford University that has 72 Nobel Prize laureates. That Oxford University does the STOIC trial, and it's a randomized controlled trial looking at just budesonide against COVID. And they showed that just using it as an inhaler twice a day would prevent 90%. This is still at Oxford University's website. Using budesonide by itself twice a day would prevent 90% of hospitalizations, ER visits, and even urgent care visits for patients with COVID when it was a deadly disease when it first came out. They actually stopped that study early because they reported that it was unethical for them to continue to give the placebo patients in that study a placebo when they had a life-saving medicine for a deadly disease. And so they stopped it on day 28. And so we had something that was proven to be overwhelmingly effective by an established reputable source, Oxford University. They did a second study called the Principal Trial. Again, they showed that budesonide was effective against COVID for the elderly. That was the focus of that study. And then a year later, the Together trial, another randomized controlled trial, was run by Brazil, Oxford, Australia, and they showed again, overwhelmingly, budesonide was effective against COVID, but you still have not seen that acknowledged by the FDA or the CDC. What we saw at the same time was we had an emergency use authorization, which is what you call human experimentation. That's what the FDA has to give to approve human experimentation in real time. It's called emergency use authorization. It's not the same as FDA approved. And the emergency use authorization for a human experiment in real time cannot be given if there's an effective treatment strategy already available. And so a person that was a member of the White House Coronavirus Task Force named Dr. Ben Carson, who has an excellent reputation, said on an interview on TV, on Newsmax, he was asked, Dr. Carson, why did this happen? He said they had to suppress budesonide because you cannot get the FDA cannot give emergency use authorization for an experimental COVID shot or experimental remdesivir if there's already an effective treatment strategy. This is Dr. Ben Carson saying that. We have the video. We have a website that was created by a third party that's owned and operated by a third party. It's called budesonideworks.com. You can see the interviews. You can see the studies. You can see the evidence there. Budesonideworks.com. I don't own it. I have no vested interest in budesonide. I just found something that saved lives, and I was kind of excited about it. I thought other people would be as well. Many people were, but who benefited from the COVID shots? Pfizer made $36 billion in 2022 alone after the COVID shot came out. Moderna made $18.3 billion in 2022 alone when the COVID shot came out. Bill Gates said on national TV, "This is the best investment I've ever made," referring to the COVID shots. And so there were people that benefited from the COVID shots, but it wasn't what we were told in the beginning. And so there's a lot to unpack here, but when the measles outbreak happened and you contacted me, it made sense that budesonide would be a benefit for any viral upper respiratory infection because they're all going to have a common pathway of a cytokine storm, of the release of inflammatory chemicals from the respiratory lining called cytokines. Those would be interleukin 2, 3, 4, 5, 6, 11, 13, 15, cyclooxygenase, thromboxane, which causes clotting, tumor necrosis factor that causes a fever. You know, just looking at one of those, cyclooxygenase, Advil, Aleve, Motrin, Naproxen, those Toradol, all of those medicines only work on cyclooxygenase. And you know how effective that is. Mm-hmm. But using the inhaled steroid budesonide, it shut down the release of all of those.
Yeah.
And so when you contacted me and said you were seeing results, and eventually I was involved in helping as well with this measles outbreak. And I can verify eventually the hospitals are prescribing budesonide now to the to the children who have recovered from measles that are having hypoxia and are having secondary bacterial pneumonia and in the hospital. They're giving budesonide to them in the hospital, in the ICU, in the pediatric ICU with the children that have recovered from measles. And even outpatient clinics with other primary care providers not connected to you and me are now prescribing budesonide for measles, which is a highly contagious upper respiratory, acute respiratory infection. And so it makes sense, but the word is out in large part because of your courage to try to save children's lives by using tools that are readily available and have a long track record of safety. Budesonide's been out for 35 years. It's generic. It's been used for 30 years on 2-pound premature babies in the NICU without batting an eye. That's as delicate a human as they make on the planet. And so if it's safe for them, it's safe for anybody. As far as risk, minimal risk, as far as a nebulizer treatment, it's safer to do that than to give Medrol dose packs, steroid pills. Mm-hmm. It's safer to do that than to give a shot of Decadron or Kenalog or Depomedrol in the hip. And so we've learned a lot during COVID, and we've seen a lot of things that were terrible medical decisions, scientifically not sound, medically not sound. But this is one of those things that has been a pearl that has come out of COVID, the COVID experience, that translates to other acute respiratory viral illnesses.
Yeah. Well, if you can share a little more about the ICU hospitalized, specifically those first couple that you were involved in. The parents had contacted me through a mutual friend, and then you showed up. But how rapid the recovery was on those children. Share a little bit more about that.
Yeah, there were two, at the very beginning of the measles outbreak, there were two children that were in the pediatric ICU at a hospital in Lubbock. They are friends of mine. I'm a friend of the family. One of the fathers invited me and escorted me into the ICU to see the daughter. And while I was there, the pediatric ICU doctor came in, and we discussed budesonide. We talked about the things that have been discovered and proven during COVID with budesonide nebulizer treatments for improving oxygenation, decreasing the cytokine release, decreasing the inflammation and the mucus production. And the ICU doctor, agreed to prescribe it. That patient had been air flighted by helicopter from New Mexico straight to that hospital ICU. So we're talking about a child that was very ill, air flighted by helicopter from one state to the other, straight to the ICU. That child was home after 3 nebulizer treatments of budesonide in the ER. Went from air flighted from state to state to ICU to straight to home, not to the floor. And so that was a pretty radical recovery. The second child that was in the hospital also took several days more to recover, but also went from pediatric ICU straight to home after nebulizer treatments. The ICU doctor ordered the medicine and honored the parents' wishes when the parents explained that that's what they wanted for their child. And so I commend that ICU doctor for listening to the parents, which are the legal custodians. They're the illegal authority for the child. And that's the way it should be in America, where there are parental rights still in healthcare, where there are patient rights still in healthcare, where there are constitutional rights still in healthcare. But we have seen that constitutional rights, patient rights, and parental rights have been suspended during COVID. And you have many doctors and nurses in hospitals around the country who still have a mindset of what they got away with during COVID. And so for some doctors and nurses, it's difficult to flip that switch and start treating people as human beings again with patient rights, parental rights, and constitutional rights. But I commend this pediatric ICU doctor for doing the right thing, letting the parents weigh the risk and benefits of treatment options and request an appropriate treatment, and for the doctor to prescribe it and think outside the box, because it is outside the box of traditional medicine. Which brings me to a thought. There are many doctors and scientists many of them are on salaries that are government salaries. And they are claiming that RFK Jr. is going to destroy the current healthcare system, thinking that he's going to break it. And so apparently they haven't. I think they need to stop taking their drugs, and they need to wake up and realize that the current healthcare system is broken. And I'll give the evidence. The CDC director lied to the American people and said that if you get a COVID shot, you will not get COVID. The CDC director lied to the American people and said if you get a COVID shot, you won't spread COVID. Both of those have been proven wrong. You have Anthony Fauci, who was giving advice that was followed over and over, who apparently required a presidential pardon because his advice was off, I guess. And then you have,
put it mildly,
and then you have the FDA that when they received an appropriate FOIA request for the Pfizer COVID shot information, the FDA said, we have that information in the computer. We've received that from Pfizer, and we've reviewed it. We don't want the American people to see this for 55 years. And then they corrected and then they adjusted their statement and said, we don't want the American people to see this for 75 years. And then I was in federal court in Fort Worth. I don't, Ben, were you there as well?
No, not that time.
And so the federal judge said, you have to release this information. And the FDA pushed back on the federal judge and said, Judge, we don't have enough staff at the FDA to release this information to the American people for 75 years. And he said, you're going to start next month. And so we received that information. So the system is broke when the FDA is trying to withhold information from the American citizens and patients and doctors. When the CDC is literally giving false misinformation, giving misinformation about fundamental things to the whole world on broadcasts. This is a broken system. So RFK doing more with less and streamlining the healthcare system, flipping it on its head where actually transparency is required by the agencies, where the agencies, the FDA and the CDC and the NIH will actually be presenting all of the information to the American patients and American citizens that they paid for with their taxpayer dollars, instead of hiding it for 75 years, the old pattern. Yeah. And so that's my message. The healthcare system is broke, but we have it's in process of being repaired.
Yeah. And I'll add on to that beyond COVID. I mean, just the chronic disease burden, which RFK really obviously talks about also. I mean, we get the worst outcomes if at the end of the day, the standard we're going to measure is outcomes, health, longevity, lifespan. How sick are you during this life versus well? We're dead last. We across the board, we get the worst outcomes of industrialized countries, and we spend the most money to come in dead last place. So I concur. The system's absolutely broken, needs a complete overhaul and a revamp. And the whole COVID thing just highlighted that. And the American public, they see it. The approval ratings for doctors went from 70% pre-COVID to 40%. The latest I saw, probably less than that now with the measles debacle. But so I'm in 100% agreement with you. You said something there about transparency. Let the American public, the patients, the people see the risks, the benefit, the pros, the cons, and then trust the American people to make the decision that they feel like is best for the individual person. And that's the thing, these protocols for the masses versus individual patient-centered medicine, and where the individual can weigh their individual risk benefit, which I think needs to transition us over to the MMR, measles, mumps, and rubella vaccine. This is a side to this story that hasn't been told clearly enough. And when I contact the state of Texas Health Authority, asking them to put out a notice of some sort to the West Texas clinics and hospitals to use budesonide. And I did that for two reasons. Number one, I saw the effectiveness. And number two, I saw the quantity of patients, and especially small kids and babies and under 12 months old. MMR stops at 12 months or should. But anyways, I just saw the benefit that it could bring. I knew that probably a lot of doctors didn't understand this because during COVID, so many didn't. But the answer was no, we can't put that statement out because our only statement we can put out is MMR vaccine. So that's a preventative. And there's a case to be made for using that as a preventative, but you look at the risk benefit, you read the package insert, we'll get into all that. But at the end of the day, that's a preventative, not a treatment. And it's like we've lost our ability to distinguish or to even talk about how to treat people.
We learned, Ben, I'm sorry to interrupt, but we learned during COVID that there was a concerted effort to suppress early treatment. Yeah. And there was an effort to suppress treatment of any kind because there was a vested interest in promoting what was called a vaccine. And some doctors actually called it out as gene therapy. You know, the Bayer Pharmaceutical president named Stefan Ulrich spoke at the World Health Summit, and he said to his peers, we know that these COVID shots are gene therapy, and that if we would have told people to roll up their sleeve and let us inject their bodies with gene therapy 2 years ago, 95% of the people would have refused. We've learned a lot. This was from Stefan Ulrich, the Bayer Pharmaceutical president. And this was spoken within the first year of COVID.
Yeah.
And so he called it out, and doctors called it that and were reprimanded for calling it gene therapy.
Yeah.
But when you look at the CDC and FDA information about gene therapy, it says you have to use products like DNA plasmids. Well, we found out, and the Surgeon General of Florida, Dr. Joe Latipo, has called it out on the Florida Department of Health website that the RNA shots, called COVID shots, are contaminated. They're adulterated with DNA plasmids. They are literally, by definition, gene therapy by the adulterants, which can enter your DNA and permanently have the potential of permanently changing your DNA and your offspring's DNA forever. Mm-hmm. And so that's what the risk is with DNA plasmids, which are contaminants of the RNA COVID shots. Right. That's not being spoken loudly enough, but I just said something that hasn't been said that clearly before.
Yeah.
The DNA plasmids literally meet the definition of gene therapy that can cause the DNA code in that plasmid to be permanently inserted in a human DNA and change their DNA permanently and their offspring's DNA forever. Yeah. That is according to the FDA's definition of gene therapy.
And the Surgeon General at Florida, Joe Latipo, also, I believe, recommended no more of these injections for children, I believe. Is that right?
Yeah, there's 30 million Floridians. 30 million live in Florida, and at the Florida Department of Health website for over a year now, it says that the Surgeon General of Florida, the top doctor for all of Florida, says he does not recommend COVID shots for one person in Florida. And so that's pretty damning when you look at it. That's very concerning. And, we know that there are 5 things added to the COVID shots that are not for human or veterinary use, according to OSHA. OSHA, the Occupational Safety and Health Administration, is the federal agency to protect Americans from dangerous chemicals. And if you look up the OSHA safety data sheet for pseudouridine, which is added to the COVID shots, it says not for human or veterinary use. If you look up the OSHA safety data sheet for SM-102, a chemical that's in every Moderna shot, at the top in bold letters on the OSHA safety data sheet, it says SM-102 is not for human or veterinary use. Every patient I take care of in my 34-year career is a human. And so this should be a hard stop. The ALC-0315 is a chemical added on purpose to every Pfizer shot. The OSHA safety data sheet says not for human or veterinary use on the front page. That should be a hard stop if you care about people. If you in Texas, it's a felony to do animal cruelty. And so if you injected this in an animal and that animal got sick, technically you could go to jail for animal cruelty with a felony. But they're telling us to inject this in our children down to 6 months old right now.
Yeah.
There's also polyethylene glycol. That is added on purpose to the COVID shots. And if you look at the OSHA safety data sheet, it says not for human or veterinary use, for research purposes only. That is actually polyethylene glycol is antifreeze in your car.
Yep.
And so we've seen how healthcare is broken, and it's on purpose. And you have people like Dr. Joe Latipo, the Surgeon General of Florida, like Dr. Ben Edwards in West Texas, who still care about patient rights and still care about informed consent. Informed consent is not an option. The American Medical Association for decades has said in their code of medical ethics that every doctor has a responsibility legally and ethically to present informed consent to every patient. That's presenting 3 things: presenting all the treatment options, the risk and benefit of all the treatment options, and if there's a financial conflict of interest. We have seen there's tremendous conflict of interest financially that is the explanation for many things that have been pushed on the American patients.
Yeah. Well, and we could do a whole show just on the damage and the injured. And Dr. Jay Bhattacharya in his Senate confirmation hearing said, we're going to get to the bottom of this injury from COVID vaccine injury, and these patients will have a voice, will be heard. And there's just so many studies we could camp out on regarding injuries from that product, that gene therapy product. I want to move to the MMR because I started asking these parents in Gaines County about vaccination status for themselves. And many, I would say the majority that I asked said, yes, I received my MMR vaccine. And I said, are your children vaccinated? And mostly it was no, although some were, and you can get measles even in a vaccinated, but mostly it was no. And I would ask, well, why not? And their answer basically was there's 14 vaccine injured children in the Mennonite community in Gaines County. So that led us to do some research, read the package insert, do a little extra independent study to try to figure out risk benefit. And we've decided to not do that injection because of the potential harm. So that wasn't, spoken of. Actually, when the CDC was talking to me and asked me to ask the Mennonite leaders, what could they do, the CDC do to help? And the only answer I got from the leadership of the Mennonites was, hey, we would like to sit down in a private room, have a private meeting, and bring our vaccine injured children to meet with so they can see with their own eyes and hear our stories. And let's talk about it. Let's get this conversation started about risk versus benefit, because actually the MMR shot has risk, including death. And even on the CDC's own vaccine adverse event reporting system, it's reported 4 to 5 deaths a year on average. We know that's underreported. So potentially only 1% of these are reported, according to the HHS study in 2010 by Lazarus. So potentially 400 to 500 deaths per year. But that's a real legitimate question based off those studies that the government's put out, VAERS and HHS both. So I know you've looked into the potential risk and benefit. You've looked at the package insert. So what would informed consent look like? So someone can decide if I want to do this as a preventative versus I'd choose not to, and maybe I'll just take my options with treatment. What would that conversation look like?
So informed consent has 3 parts: telling the risk and benefit of every treatment option, telling every treatment option, and if there's a financial conflict of interest. I have heard report after report of pediatricians right now telling people to get the shot, not telling them that there's a risk, not telling them that there's children that should not get this shot, that are contraindications. And so I'm telling parents now, do your own research. Go to the website, go to the internet, and look up the MMR2 package insert. This is in black and white, the things that are known about the MMR2 vaccine. The FDA has to approve this package insert. This is the FDA's statement about the MMR2 vaccine. And it lists many children and many adults that are not candidates for the MMR2 vaccine. I have not heard that in one infomercial by doctors who act like they're giving breaking news on measles on mainstream media or social media, or even medical education updates on measles. They're not saying that they're not acknowledging that there are contraindications. There are people who should not get the MMR2 vaccine. So look at that. The second thing is they're not acknowledging there's a risk with the MMR2 vaccine. And if you look at the package insert, anyone can get online and look up the MMR2 package insert and read it for themselves in black and white English. And it says that there's a risk with this. It's a live measles virus, just like the wild measles virus that comes from other countries to the United States and causes outbreaks. This is a live measles virus as well. And so live measles viruses, whether it comes from the vaccine or from nature, can cause measles. That's not real complicated. And what would that be? According to the package insert, it can cause a high fever. It can cause the measles rash. It causes measles. And one of the complications that can happen after you get measles, when you have tremendous inflammation in the body, is encephalitis, literally inflammation of the brain. On the MMR2 package insert, it says this product can and has caused encephalitis. This product can and has caused high fever and even febrile seizures because of a child getting a high fever. This product has caused measles and measles rash. And it also lists something that you don't normally think of with wild measles: transverse myelitis, an injury to the spinal cord that can paralyze you. I've treated one case of transverse myelitis as an ER patient when I was the ER doctor on duty. This was the one I treated. Transverse myelitis was someone who 2 hours before had received a COVID shot, went home, and in the living room tries to stand up 2 hours later, and her legs don't work and she falls flat on her face. She's paralyzed from the waist down. That's what transverse myelitis looks like. And so for the MMR2 package insert to include transverse myelitis, that's what we're talking about. Encephalitis, where you have inflammation of the brain, the computer for the body, can cause hallucinations, seizures, death. That's what encephalitis can cause. And the MMR2 package insert says that the measles virus in the MMR2 vaccine can cause encephalitis. And so I haven't heard one pediatrician, I haven't heard one expert, and I recently was on a measles update for doctors that was sent to me by email with 4 experts. And they didn't acknowledge the contraindications. They didn't acknowledge the risk. They just did an infomercial pushing what they consider the only option, which is for everybody to get a measles shot. Mm-hmm. And so that is not right. Parents need to hear the risk and the benefit in all treatment options, and they need to weigh the risk and benefits and decide what to do for their child. That is fundamental patient rights that are being trampled right now. And doctors that fall into this narrative that everybody is a candidate for a measles vaccine, they need to lose their license. Mm-hmm. They need to go back to medical school, and they need to learn that patients need to be treated as individuals, because there are children who have been injured. And what you said, you and I are well aware that we still don't have a measles death in the United States, even though they're saying we had our first measles death. That child had recovered from measles. That child developed bacterial pneumonia with a bacteria called Mycoplasma pneumonia. The test results were on the chart. A famous pulmonologist reviewed the record with the parents and said publicly, so I'm literally quoting Dr. Pierre Corey, a famous pulmonologist who looked at the record and said, it's cut and dry. They had the evidence in the lab part of the chart that the child had Mycoplasma pneumonia and was not treated with the right antibiotic for days in the hospital on a ventilator. And so that brings me to, Ben, the third leading cause of death reported by many reporters is medical error. Medical error is the third leading cause of death in the United States. Yeah. And so that's not measles. That's medical error.
Yeah, 100%. To play the devil's advocate, anyone that would be listening from, I would say, the uninformed side, they would say, oh, those package insert risks are so rare that basically it's not even worth mentioning, because this vaccine is just so protective and helpful from that there's no way you're going to get those. That would be a thought. They're so rare. And then I think second would be vaccine hesitancy. If we really tell the truth about the potential rare side effects, that could drive vaccine hesitancy. But from my observation and talking with patients and parents, the vaccine hesitancy is being driven by the lack of transparency. Because this data and information is now available for independent parents to go study and find, the fact the government won't even, and the health authorities won't even come to the table with a confession of, yes, there are injuries. Yes, these are happening. And let's talk about a way to risk mitigate. The failure to even have the conversation at all, to just blindly come and just parrot this same stuff. And like you just said on that education group you watched, they don't even talk about it.
Oh,
That's what's driving the hesitancy, is the refusal to have the conversation.
Ben, on that medical update for doctors with measles, with the 4 measles experts, they were struggling to describe the rash because in their own admission during that information continuing medical education, they admitted that they have not seen measles or treated measles. You have medical experts who are struggling to tell you what the books say that they just read right before they got on this thing as the quote expert, and they're being promoted as experts. And by their own confession during the continuing medical education presentation, it was very quick. It was very obvious to me in 1 minute that they hadn't seen measles. They didn't know what they were talking about, but they admitted on the video that they haven't seen measles or treated measles, and yet they're the experts. It's the blind leading the blind. And so this is right now what's happening. It's a very popular medical education update that's being presented to doctors on in their email around the world right now. So this is a propaganda campaign. This is a marketing campaign where their only solution is to tell everybody they better get a shot in the arm. Doesn't matter if they have a history of febrile seizures. Doesn't matter if they've had a complication from vaccines before. It doesn't matter that they have family members that have been injured by that same product. It doesn't matter that they have a fever right now and they have an infection right now. They're not acknowledging any of that. Those are all contraindications to getting a measles MMR2 vaccine.
Yeah.
And they're not acknowledging that. And I'm not so sure they're even aware of it or even care, because they have their assignment is to do an infomercial advertisement promoting a product. And that's not what we do. And I told RFK and his team, the American people can handle the truth.
Yeah.
And, if you sold, what would be the penalty if you sold your house knowing that it's infested with termites and about to fall over, that it has a mold problem, and that it has some tuberculosis and other problems in it, and you don't disclose that and you sell it? There is some recourse there that you will be held accountable.
Mm-hmm.
And that's just a house. You could buy another house. You can change houses, but you can't change your body.
Yep.
And you can't change your child's body. And yet you can get the Carfax on a car, and you can find out every little scratch and every ding and every problem in that car on that $1,500 clunker. And you can get a new car, but you can't get a new body. Yeah. Informed consent is a basic fundamental right for every human in the United States. It's not a right in every country, by the way. And I'm about to be interviewed by a reporter for the oldest newspaper in Japan about the patient rights and the medical freedom movement. And so I'm just telling you, there's other countries that you would think would have freedom like we do in the United States, and it's not there. We have basic fundamental patient rights, constitutional rights, and parental rights that have been trampled and violated for 5 years now. But they're still our rights. And so you got to stand up for your rights.
Yeah. We've got about 10 minutes left, Dr. Bartlett. I'd like you to maybe speak to, if you were in charge, and I'm thinking more to doctors, medical school education, the future of medicine. How do we write this thing? Obviously, RFK is doing what he can do or starting to do that, and we'll see what happens. But I see just this fundamental divide, and patients now are just getting so educated, and they're so far outpacing in their demand for true healthcare and freedom versus this, what seems like a very stubborn, put my heels in the ground, we're just going to continue with this old way of thinking and doing. How do we turn this thing around? How do we improve our health outcomes, improve our education, and improve the way we do doctoring?
So doctors in the medical healthcare system have been dumbed down over the last 20 years. Mm-hmm. And have not been encouraged to teach themselves, to pursue knowledge, to sharpen their skill set. What we've seen is a dumbing down where we're going to tell you what to think. We're going to tell you what, without evidence many times. And I'll give you an example. When the CDC director says something, everybody just quotes it like it's the gospel, like it's a fact. And we just saw the CDC director lie, saying that if you get a COVID shot, you will not get COVID. That's not the truth.
Yeah.
And so we saw case after case. So how do you fix this? Well, you start setting up a system where doctors are encouraged to research. They're encouraged to do their personal due diligence. That is, we expect other disciplines, other careers to do due diligence, and they'll be held accountable if they're an architect that hasn't done due diligence, if they're an engineer that hasn't done due diligence. But in healthcare, everybody's been given a pass because of certain laws that were passed. The PrEP Act in 2005 covered egregious offenses like children going to a public school, being pinned down and given a COVID shot against their will without their parents' knowledge. And then it's thrown out of court because it has no standing legally because of the PrEP Act. We have laws like the PrEP Act, the child vaccine injury law in 1986 that give immunity to whole segments of our economy. The vaccine manufacturers cannot be sued even if it's proven they killed your child. These things are not good. We need to have doctors being retrained to think, to teach themselves. They might have some ingenious new strategies to handle old problems that have plagued us for centuries. But if you don't teach the doctors to teach, back when you and I went to medical school, we learned in medical school that we had to teach ourselves. We were not going to get all the information in a 1 hour lecture every other day. Mm-hmm. We had to teach ourselves the information. These days, there's the ability to do logical thinking and research on your own has been taken away from many doctors in the recent training, and so that needs to be reversed. It needs to be happening at the medical school level, the residency level, where they are taught common sense strategies, and the responsibility of learning is put back on their shoulders.
Mm-hmm. Yeah, well, just like you did when you were in the call room, and whether someone's Christian or not, just the thought of a creative thought and some critical thinking. It seems to me we're going to this protocol based, and some institutional body, government bodies giving that protocol, and who's influencing them. But this protocol driven, I'm sure AI is going to come into the mix. I don't know where, maybe doctors will just stamp approval of the AI generated protocol versus what I'd say DI, divine intelligence, versus artificial intelligence. But human intelligence is what you're speaking to. And you incorporate DI into that, that's even better. And that's what you did. But just that critical thinking, clinical experience, I encourage training doctors that come here or doctors that just call me to go way back and look at the original definition of evidence-based medicine. Came out about the time I was in med school. And it is looking at the best published research, peer-reviewed research. Go study that. But then you take your clinical expertise. You have a lot of clinical experience and other physicians and colleagues and mentors have their clinical experience. You can incorporate that. And then ultimately, like you're a big advocate of, and so am I, the patient values. And you combine all that. You don't blindly just follow some published data that who knows who influenced that. And John Ioannidis came out way back, I think it was 2006, and published, and he's a Nobel laureate out of Stanford, Dr. Ioannidis, and he said the vast majority of medical research today is false. And many studies, Mayo Clinic did a study, I believe this was in 2011, where they looked at 368 different standard of cares versus published research, and 40% of them, the research said this standard of care should not be being done right now. I've read other studies where it takes on average 20 years for a doctor to change his practice when some new evidence is published. It says he should. So there's just this, I don't know, herd mentality and protocol-driven nature of medicine that's destroying us, really. And then you mix in arrogance and pride, and doctors hate being wrong. And then you put a government body on top of that saying we're right, and those doctors line up. And then who suffers? The patient. Patient outcomes suffer. But I'll give you the last word, Dr. Bartlett. We have just a few minutes left.
Yeah, patient rights are bodily autonomy, your body, your choice, in a positive, in a real way, not an adulterated way, where it's your body. And if you got cancer, you get to decide. And we all agree on this. If you have cancer, the doctors and everybody says you have options of chemo, radiation, surgery, holistic, homeopathic measures, hospice, you can just give up, no treatment. And who gets to decide that? The patient. But that needs to translate to everything in healthcare, whether it's measles, whether it's vaccination, whether it's a surgery, whether it's early treatment strategy for a new disease. That has not been allowed during COVID. It was a change where rights were suspended. And so we need to get back to informed consent, patient rights, bodily autonomy. And we can do this. We got RFK. He's the right man at the right time. And he has some insights that we need to listen to. And so I have hope. We're not helpless or hopeless. We weren't helpless or hopeless during COVID. There was definitely a fear campaign to the masses to cause everybody to make decisions out of fear, that you would kill yourself, that you'd kill grandma, that you would cause an outbreak in your family if you didn't comply with their only option that they were promoting, which had financial vested interest in, which was a COVID shot. And so I'm saying that really clear. And we learned a lot during COVID. We're seeing again an agenda to demonize anybody that says maybe an MMR2 vaccine is not for my child, and to label them, to name call, to finger point, to be obnoxious on mainstream news, quote news, but it's really propaganda and marketing. At this point, it's marketing. Yeah. And so I encourage everybody to do their own research, pray, and make the right choice, because actually you're the one that's going to have to live with it.
Yeah, that's right. Well, I do want to echo that encouraging word. There is hope. There's always hope, not just hope that in Dr. Edwards, Dr. Bartlett, other frontline doctors during COVID. Yeah, it's good that there were these frontline doctors who did treat and didn't go with the narrative. But ultimately, there's a deeper hope. And what I try to tell my patients is the hope is in this amazing design of your body. When you steward that design, it'll do what it's supposed to do. It'll repel chronic disease. When germs come in, it'll deal with it. When you need to do some extra treatments, that's fine. But trust in this design and steward this design, and fear cripples this immune system and the mitochondria. And this entire design is really crippled by fear. So anytime fear is being used against you to try to influence your decision, it's timeout. It is absolutely a time for a timeout. I would encourage you to seek a higher authority, a spiritual authority, and let peace guide you. That's my number one recommendation. Let peace be your guide. Dr. Bartlett, thank you. For me, I'll just say we'll end on this. COVID, like you said, this massive fear campaign came out. Nobody was sure what was going on at first. We were all just kind of deer in the headlights, and then these protocols started coming, and some frontline doctors emerged like yourself, and we saw, no, we can treat this thing. But it was such a massive thing, and we're all on the same page for a while, and then there's enough. But this measles outbreak, for me personally, it was more impactful and hard because these are little babies, especially the real tiny ones, which there were a bunch of. They don't even qualify for MMR at the age they were at. But the refusal of doctors to treat, authorities to help, and encourage doctors. I felt like I was on an island, and I'm not trying to say I was anything special. It was just, I'm driving home at midnight from Gaines County, making house calls on the way, and these poor little babies in these homes I was walking into, just scared. The mamas were scared. And to think, man, there could have been an amazing way to bring a lot of resources and people to attack this thing. And you stepped up and you were there. And I don't know how many dozens and dozens, and over 100, over 200 or 300 probably combined, that we saw in those little clinic days. So I just want to say thank you, because it was a hard time for me. Now I get my strength from the Lord, but when a brother comes along and assists and loves his neighbor more than he loves his reputation, his license, his paycheck, his what people think about him. You love your neighbor and you do what's right. And so I commend you for that. I thank you for that. And I'll never forget the days we spent together in Gaines County.
Dr. Ben Edwards, thank you for your friendship. And I count you a colleague that I look to and I respect greatly.
All right. Dr. Bartlett, what's the best way for people to follow you, or do you do that? Do you have books, websites, do you do that, or do you just patients?
I have CNN and CBS and enemy states trying to track me down all the time for interviews. So I try to just keep a small fingerprint. So I
hear you.
If you go to budesonideworks.com, you'll see information that I'm a part of. And also, if you go to johnfleetwood.com, JONFleetwood.com, you'll see information from an investigative journalist that is collaborating with me. So johnfleetwood.com and budesonideworks.com. And I may start having more of a presence now that we have President Donald J. Trump in as president and RFK Jr. as HHS secretary. But in the meantime, johnfleetwood.com and budesonideworks.com. There's different tabs, media tab where I put interviews there. They're gracious enough to put those on, and the studies. And so we'll keep in touch. And I'm honored to be on your podcast today, Ben. Thank you, sir.
You're welcome. Dr. Richard Bartlett, thank you so much again for all you do for the people and for being on the show today. Everybody, this will be on our website, veritaswellnessmember.com, on our YouTube page, Instagram, everywhere. So check it out there and all the podcast platforms too. We'll be back next week with another great show. Remember, you're the cure. Bye-bye.